Dr. Peter Glidden, your steadfast advocate for health. Today is April 2nd, 2020. Thanks for tuning in. Let's take a look at what's going on in the inside out, upside down, Alice through the looking glass crazy world of coronavirus madness. A couple things that are interesting to note, that only someone like myself, I think, might pick up on. Let's take a peek. A virus has a death rate, right? A virulence factor, so to speak. How many people, by and large, of the people that are infected by the virus are killed by the virus? Different viruses have different death rates. Very difficult, actually, to measure all of this effectively. Most people think that measuring how many people have the coronavirus is like going into a restaurant and counting how many people have red hair. It's not that simple. And it's not that simple either when you are trying to track how many people actually get the flu every year and how many people actually die from the flu every year. The Centers for Disease Control uses fudge factors in their guesstimates for these numbers. For example, in the 2017 to 2018 influenza epidemic, the original reported numbers were 79,000 people dead from the flu. And just a little while ago, they recalculated the numbers and they moved it down from 79,000 to 62,000. Well, that's a significant change. Well, why did they do that? Because being able to figure this stuff out is not cut and dry like you think it is. And, we have Hollywood science fiction to blame for that. We think that you lay the person on the exam table in the Starship Enterprise and you can know everything that's going on. It's not like that. The testing for coronavirus, not that sensitive or specific. The swab has to touch the virus specifically. It's not a blood test where you look for antibodies that are generated by the human body in response to a viral infection. And there's talk around campus as to whether, in fact, they're testing for the new novel coronavirus specifically or coronaviruses generally. And odds are high that if you've ever had a cold or a respiratory illness in the past, that it was probably due to a coronavirus. So a lot of misunderstanding here, misdirection, and this is what happens inside of a medical monopoly. And remember, we haven't had a free medical market since 1912, when under the influence and persuasion of the Carnegies and the Rockefellers, the Congress of the United States gave the American Medical Association exclusive control over who could and who couldn't practice medicine. They exerted a hostile takeover of the medical industry and maintained their position at the top with the unimaginable wealth and political power of the pharmaceutical industry. But I digress. So let's take a look at these numbers. These were the death rates as reported at the Johns Hopkins website from the coronavirus in March, right? 3.8% in China. You can read the numbers. Italy, 3.8, Iran, 2.6. Now, generally speaking, at the beginning of an epidemic, you expect the death rates to be higher than they are at the end of the epidemic, because the idea being that more people are actually infected than you think are infected, so that would automatically adjust the death rate lower, right? Well, take a look at these numbers that were just released today. The death rate in the last month went up in China. It went up in Italy a tremendous amount. We're going to talk about that in a second. Went up in Iran, went up in France, a lot, not just 1/10 of a point, right? 2/10 of a point, 2/10 of a percentage. These went up a lot. Spain went from 1.4 to 9%. Italy went from 3.8 to 12%. And the U.S. was the only country where the death rate came down, which is what you would expect. Now, is that a function of bad reporting? Is it a function of bad testing? Is it a function of incompetent doctors in the field? What's going on? Well, in point of fact, nobody knows. And this is a problem. And, we're basing these draconian public policies now on guesswork. And, I'm going to call a spade a spade. The conventional scientific community has their heads up their rear ends, and they've let us down. Because it's number one. Number two. So something smells rotten. Something is rotten in the state of Denmark, right? So, number one. Number two. A virus or a bacteria is as deadly as it is. It doesn't change week to week or month to month, right? The virus, which is ostensibly at play here, the new novel coronavirus, is as deadly as it is. It doesn't get more deadly when it crosses a state line or crosses a country line or goes around the world, right? It doesn't. So why are the death rates so remarkably different? I mean, 1.6% now, 2.4% in the United States, 12.7% in Italy. That's a gigantic difference, which is unexplainable by normal statistical variations. But nobody's saying anything about this. Not in the mainstream media. So there's only a few possibilities here that can cause this. There's only a few possibilities. The first possibility is that it's not the same virus in Italy as it is in the United States. It's a different virus. It's a different virus, different strain, different something. It's not the same thing. That could be one explanation. Here's another explanation. This is a very interesting article. This was published in January of 2020 in the journal Vaccine, which is as straight-laced, mainstream, conventional allopathic medicine as it gets. So they looked at a bunch of Army soldiers, I think, people that work for the Department of Defense. And, everybody that that's in the military is vaccinated, often many times to high degrees. And they did a study to look to see if vaccinations, especially influenza vaccines, have any negative effects downstream. And here's what they found. And this is kind of a breakthrough. I don't know why this isn't being reported in the mainstream, but it's not. So this phenomenon of getting a vaccine and then having the effects of that vaccine make you susceptible to other illnesses downstream is called virus interference. Vaccine virus interference, right? And here's what they found. This syndrome of having a vaccine weaken your body to make it more susceptible to other illnesses downstream was significantly associated with coronavirus. So that means that people who have previously had the flu shot are more susceptible to getting a coronavirus infection in the future. By the way, a 36% increase. Now, what does that have to do with Italy? Well, I don't know. But if it looks like a duck and flies like a duck and quacks like a duck, it's probably a duck. According to the website Doctors in Italy, in September of 2019, a flu shot called VIQCC that is produced from cultured animal cells rather than eggs. It's called the quadrivalent flu vaccine. Has two types of H1N1, or two types of A viruses and two types of B viruses, influenza viruses. That was rolled out in Italy. Now, I don't have data of other countries that this was rolled out in. I have no idea. But we have a published study in the journal Vaccine that said people vaccinated with the flu vaccine are more susceptible to coronavirus infections. And we know that they rolled out this brand new flu vaccine, brand new, by the way, in September in Italy. Now, is that a coincidence? I don't know. But somebody needs to figure that out. Why aren't the talking heads looking at that? Well, you can postulate as much as you want. But nonetheless, these are subjects which have been published, which are relevant, which need to be run down. I mean, if you were Sherlock Holmes investigating this crime scene, wouldn't you want to run these data down? Why isn't this happening? Well, we can speculate as much as we want. And then, of course, there's a curious case of India, which just beggars, this is a curveball to the world. So as of today, April 2nd, there have been 2,536 confirmed cases in India with 72 deaths. Now, this in a country of 1,380,000 people with no social distancing, no stay-at-home orders, shelter at home, right? None of that. You ever been to India? You try to do social distancing in India, forget about it. It's not going to happen. It's a completely different culture. And if the meme that the reason the Italians got hit the hardest is because, they're more social than anybody else in the world, that's a lie, because they're not any more social than the Indians are. With the Indians, it's all about social interactions. It's all about family. It's all about group gatherings all of the time. Young Indian men often walk hand in hand together. They hold hands when they walk down the street. It's not a sexual thing. It's just a social thing. It's a different culture. There is zero social distancing in India, and there never, ever could be. Plus, 1,380,000 people. Now, here's where it gets even more interesting. The first confirmed case in India was right around March 1st, 2020, and there's a death rate there now of 2.8%. However, let's compare this to the Netherlands, which had the first confirmed case at the end of February, so more or less the exact same time frame. In the exact same time frame that the coronavirus showed up in India and the Netherlands, in the Netherlands, 12,667 people have become infected. 1,040 died. That's a death rate of 8.2%. So the death rate in the Netherlands is higher than the death rate in India. And the number of cases in the Netherlands is, a lot higher, 8 times higher than in India. Which means, all things being equal, there should be about 100,000 confirmed cases of the coronavirus in India, given the population distance. And, there should be probably way more than that because of zero social distancing in India. These numbers do not add up. They do not add up. Now, what's the reason for this? Well, here's something that nobody except me is talking about. Oh, by the way, that's the population number in the Netherlands, 17,125,000, right? So when you do a population adjustment, there should be, all things being equal, about 100,000 cases of coronavirus in India. There's only 2,500. What's going on? I don't know what's going on, but it's worth trying to figure out. Here's perhaps one reason why the coronavirus pandemic has not slammed India harder than any other nation in the world, which you think that it would, given the infectious nature of the virus. That's why we're all sheltering at home. That's why everything is locked down in the United States, because it's so infectious. Well, we know there are cases in India. We know they've been there for a couple of months, the same as in the Netherlands. So the numbers don't jibe. They don't. At all, they don't. Here's one possible explanation. India has had an ongoing, strong relationship with the homeopathic medical discipline for a long, long time. Homeopathy is more accepted and more widespread in the Indian culture than any other culture on planet Earth. For almost 200 years, homeopathy has been used by all sectors of the population. 100 million Indians depend solely on homeopathy. It's recognized by the Indian government as a national system of medicine. There are 225,000 homeopathic doctors, 12,000 more being added each year. Government hospitals provide homeopathic treatment. Recent years have seen a 50% rise in patients seeking homeopathic treatment. And the country of India has done fantastic work using homeopathy as a a vaccination of sorts, a preventive measure for their population. No other country in the world does that. Now, I just produced a 2.5-hour video on demand where I interviewed a number of world's leading naturopathic doctors, one of whom was a homeopath. And in that video on demand, we talked about the use of homeopathic medicine in India, in Cuba, and in Brazil to prevent infectious outbreaks. With remarkable success, by the way. This is entirely possible. It is entirely possible that India's use of homeopathic medicine is the reason that they have not been slammed by the coronavirus the way that they should have been. But again, nobody's talking about this because, homeopathy, that's all placebo, that's all taboo. It's nonsense. The only reason that meme has been generated over the last 70 years is because homeopathic medicine stands in direct contradistinction to allopathic pharmaceutical medicine. Homeopathic medicines are unbelievably inexpensive, without side effects, and they attempt to cure the condition. They attempt to bring the patient into a state of health. Now, does your blood pressure medicine do that? No. Does your heartburn medicine do that? No. Do any prescription medicines attempt to bring your body into a state of health? No. The pharmaceuticals exert a hostile takeover of the body, the intention of which is to push the body in a biochemical direction that the doctor thinks is best. It's a hostile takeover, antibiotic, anti-inflammatory, antidepressant, antiviral, etc., etc. It's not curative, it's managerial. They don't attempt to bring people into a state of health. They attempt simply to manage things, which, by the way, is why, under the care of conventional medicine, people all around the world, the older that they get, the sicker that they get. And it's not because they're getting older, and it's not because they have bad genes. It's because they walk down the road of life, there's an imbalance in the system, their system develops a symptom, then they get an illness. And then they go to the only show in town, which is MD-directed allopathic pharmaceutical centrist medicine, and are prescribed a pharmaceutical agent, at a hefty price, the intention of which is not to cure the condition. The intention of which is to manage the condition. And so the condition is managed, but in the bargain, the patient's made weaker. And then another prescription has to be added, and then another illness develops, and then another medication, and so we go until death do us part. The last 10 years of a person's life under allopathic medicine is a revolving door to the doctor's office. And the treatments don't make people stronger, they make people weaker. And so, you're 70 years old, you've been weakened by 70 years of allopathic medicine. You get an influenza virus or the coronavirus and you're down for the count. Now, again, nobody's talking about this and everybody needs to be talking about this. Now, here's an interesting point to ponder. Every epidemic in the world so far in the world follows a bell curve. The infectious agent comes out of nowhere, rises to a crescendo, and then tails off and disappears. Polio was a perfect example of this. By the way, the polio vaccine, the Salk vaccine, which was the miracle cure for polio, was administered at the tail end of the bell curve. That's like me, saying I have a machine that makes the nighttime turn into day, and I turn it on 5 minutes before sunrise, right? It's nonsense. But again, I digress. Infectious illnesses all follow a bell curve. Here's what happened in China. You can see the graph over here. In China, the coronavirus epidemic took about 80 days from start to finish, right? And right around day 50, it spiked, more or less. These are not hard numbers. They're approximations, but they're pretty good approximations. Spiked at day 50. Right now, if you look at the data from the very first infection, right, at the When was it? The end of January. We're at day 68, but really, if you look at the graph here, and by the way, this again from the Johns Hopkins surveillance website, coronavirus virus surveillance website, really, things didn't really start to be real here until right around the beginning of March, so it's more like we're at day 33 than day 68. So, therefore, because I'm the smartest person in the room, my projection is that this coronavirus will spike right around April 19th, a couple of weeks from now, and it will start to tail off, and it will be more or less gone by May 19th. Those are my projections. Now, is isolating at home a good idea? Is social distancing a good idea? Is shuttering every business in the United States so that 25% of the population goes bankrupt a good idea? I don't know. Because remember, the death rate in the United States of the coronavirus is coming down dramatically. And I'm going to bet you that after everything is all said and done, it's going to be below 1%, which is more or less the same as the influenza virus. And again, there is controversy along those lines because, as I started out saying in this video, the numbers are not cut and dry. Not only for the coronavirus, but also for, historical influenza infections. The numbers are not cut and dry. So, because we exist inside of a medical monopoly, and we've existed inside of a medical monopoly for 108 years, and it's good to be the king, right? The medical doctors exist in a self-policing, self-regulating industry, which is the sacred cow that nobody can criticize. And what do you call the person who graduates last in medical school? Well, you call them doctor. And these are the people that are ostensibly running the show here. I mean, I dissected in 15 minutes here, 3 or 4 things that the medical community should be focusing on to try to explain, but it's not happening. It's either not happening on purpose because there's a hidden agenda that we're unaware of, or it's because of incompetence. Which is it, ladies and gentlemen? I don't know. Inquiring minds do want to know. I have, however, taken a stab at getting rid of the international anxiety here, right? At my, you can go to this website, riseupintohealth.com. Riseupintohealth.com, where there's a link there for my video on demand title, 2.5 hour interview. I interviewed 4 of the leading holistic medical research people, doctors in the world, getting their take on what to do for the coronavirus. This comes along with a 13-page PDF document which outlines prevention and treatment strategies. Treatment being how to strengthen the immune system in the face of a viral stress. Great stuff. And if you enter the promo code GLIDDEN, Glidden, Glidden at checkout, you'll get 25% off. Sound good? It should, because a little bit of knowledge goes a long, long way here. Because we are inundated with smoke and confusion for no earthly reason. I am and always will be your steadfast advocate for health, Dr. Peter Glidden. Live long and prosper. God willing, and the creek don't rise. I'll see you around campus.